So without further ado, I would like to welcome Vanessa Maison, she's a senior manager over there, and Frieda McAlear, a program manager from ZeroDivide. Are both you guys going to talk?
Yes.
You're going to drive? You're going to drive and talk. Good. Don't drive and talk.
Well, great. Hi, I'm Vanessa. This is Frieda. And so we're just going to tell you a little bit about our first app building project, which is called Plan Pilot at this point. So as Miles stated, ZeroDivide is actually a nonprofit consulting company that's a couple blocks away from here. We help leverage technology for underserved communities. And so as part of our mission, we entered into this Robert Wood Johnson Foundation funded app challenge that's around helping people select health insurance that's both affordable and also meets their healthcare needs. So this is how Plan Pilot was born, because we're now a finalist in this challenge. So I just want to tell you a little bit about what the real needs are here. So health insurance, it's crazy, it's complicated, it's overly complex. It's that way for all of us, and it's even worse for sort of underserved consumers. So these are people who are, in general, have maybe not had a high school education, English isn't their first language, they generally make far less than what our average tech salary is. And so we really set out to build an app to help these individuals. So just a couple statistics to pay attention to. 8 million people signed up in the first enrollment period. About a third of those, after just 3 months, already said that they were upset with the plan that they had bought. More than half of those thought that they couldn't even pay for a major injury or illness. So they didn't really feel protected. And so after seeing this, and then with the app challenge, ZeroDivide really went out into the streets and did a number of interviews and online surveys to find out, well, what can we do to actually begin to solve this problem? People not really understanding how their health insurance works. So that's how Plan Pilot was born, really about how can we kind of leverage the best of both data as well as design to really address some of these barriers to understanding how to use health insurance. So really what we're really focused on is both the data behind it, so really getting at what sort of questions do people need to consider. So not just the demographic questions, but also about how do people use health insurance, like what kind of conditions do they have, what kind of drugs are they using, and trying to account for that in this sort of total cost of healthcare. And then also on top of that, like the available federal subsidies, so how can they begin to kind of account for the affordability along with the coverage that they need. And then with our particular community, really taking into account that broadband internet access isn't always maybe going to be their first sort of recourse. Like they may be accessing it on a tablet PC, like at Wi-Fi at McDonald's, because that's their source of internet access. So really needing to pay attention to how HTML5 responsive design there as well. So this is just a visual representation of our data algorithm at this point. So as I said, we're really trying to not just have people buy insurance, but have them understand how to use insurance. And so really trying to get them to kind of think about if they already have diagnosed conditions, and also be able to better understand how to forecast how they can use health insurance. Let Frieda.
Hi everybody, my name's Frieda. Oh, this is loud. So we wanted to kind of go over a few of the key features. Vanessa laid out the sort of overarching idea, the narrative that we're building here. And I just wanted to talk through a couple of the ways that our app is different to what's currently on the market. So most health insurance shopping apps currently out on the web these days will treat health insurance shopping almost like Christmas tree ornament shopping. So kind of a once in a year activity. And we've really tried to think through how we can build in engagement and evergreen tools for our consumers to be able to use our app throughout the year and throughout their health insurance usage. So just a couple of these here. One is that we want to build in robust scenario planning. So besides just talking about the true total cost, we want to go beyond that and provide people with tools in order to understand if they needed to have a medical procedure done, or if they wanted to start a family, for example, in a particular year, how is that going to affect their true total cost of care and their out-of-pocket expenses. This is something that's currently not very transparent in the marketplace. Another is we have social sharing features, so that people who are thinking about shopping for a plan, they want to tell their family members about it, they want to take notes on their plan options, they can do that inside of the app as well. So there's a little bit about that. I just have a minute left. This is one of the shots that basically drills into one of our engagement tools here. This is our drug discount and pricing tool. This is because a lot of the target population and a lot of the target consumers that we hope will use our app have pre-existing chronic illnesses and medical conditions, and they're already getting treatment and pharmaceuticals for those. So we want to be able to provide those users with a way throughout the year to be able to effectively cost, plan for, and model those medication expenses as part of their health insurance usage. We do have some monetization ideas, of course, so this is this slide. And we don't really have time to go through all of them, but I just wanted to say we're looking at affiliate relationships as a primary revenue stream, also white labeling for state health insurance exchanges, clinics, and brokers. So this is our team. We're here. I'm here for another half an hour. We'd love your questions if you want to know more about our app or about ZeroDivide. Thank you.
Okay, so raise your hands high if you'd like to ask a question or two.
Hey, thank you. I learned a lot about your product, but what is your go-to-market approach? What is your go-to-market approach? How are you going to plan to attract many customers for this product?
Sure, so ZeroDivide actually, its current incarnation is more of a services organization, but we started out as a foundation that was funding technology and sort of innovation and experimentation for underserved communities. And so we have a long history in sort of existing community partnerships with a number of sort of organizations and sort of key institutions within the communities which have our target consumers. So things are kind of like health and human services agencies, kind of more like civil rights organizations that have been doing a lot of community organizing. So what we found through our research is that a big part of this isn't just the price consciousness of this, it's also the trust that people have. And so leveraging those relationships for a go-to-market strategy is really what we're moving toward.
Hi. I think currently with the midterm elections, we're all aware that the Republicans may be destroying the federal exchanges. Is that going to change your business plan?
As things stand, we just kind of have to act with what currently exists. Politically, the Republicans have tried to defund the Affordable Care Act, like I think 40, 50 times or something like that, and they haven't been successful thus far. So, you know, and then of course, you know, the sort of complexities of the healthcare market. About half of the states have their own sort of state marketplaces, and about half are really relying on the federal government to provide the services. And so we're really especially trying to focus on that second half that don't necessarily have that support, and really trying to help consumers have a clear source of health information and guidance, because there's also a lot of misinformation that happens in the local level.
Looking at the interviews during your original research, what was the sample size that you were looking at?
So it depends on which wave of this you looked at. We started this project at a hackathon, and so did some kind of like man on the street, like user interviews there. We've also done a number of online surveys that have been about 30 people so far. Done additional user interviews, kind of looking at what are potential sort of similar sites, and that's been about 5 to 10 people, and then continuing to do ongoing user research actually right now.
So if you had one big wish to come out of this room, what would it be tonight?
Money. Barring that, I mean, we're all wishing for money. I think barring that, of course, like strategic advice. If any of you, especially on the business development side of things in terms of go-to-market, like that's always a good thing for us to have on hand. I'll let Frieda.
Anybody else?
Hi, I have a question regarding the information. So you are saying that people can enter their condition and the type of medicines they are using and shop for the best program. And you're afraid that people are going to be defensive in terms of entering information because they are afraid that the insurance company do not want to provide them with services because they have all those diseases or spending all that money on medications.
Sure, at least from the user research that we've done so far, like people aren't necessarily reluctant to provide that disease information, and as far as the insurance company goes, they can't discriminate based on what your health condition is. A lot of what we're dealing with so far is this sort of like this idea around health insurance literacy. So even the Kaiser Family Foundation actually just released a recent survey, and something like kind of like 40% of people can't even answer. You know, they answer less than half of questions correct on some basic health insurance terms, like, you know, a formulary, like the list of the drugs that your company covers and how much you have to pay for them. Things like, you know, how to calculate your out-of-pocket costs. So that's really like the big hill that we're up against, is that people tend to shop and they buy the sort of the cheapest low premium plan. But then when they go to sort of use insurance, it's like, oh, I have to pay my premium every month. I wasn't aware of that. Or this deductible is $8,000. Well, I only make $35,000. So like, how am I supposed to, you know, spend $8,000 out of pocket before I start getting things covered? So those are really where we're finding where consumers kind of aren't kind of getting that understanding.
And that's a great question. One of the things that we're trying to make sure happens is that we don't capture personal information in the shopping experience, and the scenario planning fits into some of that too, where they can look for, you know, their particular conditions and see how that affects the plans that come up, but without having to commit and enter in who they are at that point.
Excellent. We're out of time, but thank you so much.